So there are many different things that go into using an ultrasound machine, and we're going to be discussing the different topics today. You can't just memorize a flow sheet or a cheat sheet and be able to use this in the clinic, because a patient's going to ask you why and what you're doing, and you're going to have to be able to explain it to them. So this is the general flow chart that we're going to be going off of. So the ultrasound machine can be used for different injuries. So the effects of the ultrasound are thermal and non-thermal. And down here you'll see that you would use the thermal aspect of the ultrasound if you wanted to heat up tissue, increase circulation, increase soft tissue extensibility, decrease pain or muscle spasms, while you'd use the non-thermal settings for facilitate healing or to decrease prolonged inflammation. The next aspect on that little flow sheet is the duty cycle. So the duty cycle determines the thermal or the non-thermal effects. If you have it on 100% duty cycle, it's going to be a continuous wave that goes down, and that will get it to be thermal. If it is on 20%, it's going to be pulse, so the person's not going to feel the continuous heat, and then that would generate the non-thermal effects of the ultrasound. So after duty cycle, you can see that we have depth of the problem. You have to know your anatomy in order to use the ultrasound. You have to know what areas you're targeting. Bone is deeper than muscle. If you want to get to the bone, you're going to have to use a different frequency and different intensity than you would use if you're using the muscle. So next on our list, as you can tell, would be the frequency. So the frequency controls the depth of the ultrasound. The more depth that you are going, the increase in depth would cause a decrease in frequency. You want the higher frequency with the less dense area. So you would typically use 3 hertz for an area that is a centimeter or 2 deep, and then 1 for an area that is 3 to 5 centimeters deep. Next on our list is intensity. So the intensity decreases with an increase in frequency, and it increases with a decrease in frequency. The intensity is the rate at which energy is delivered. For non-thermal use, you'll want 0.5 to 1 watts per centimeter squared. And for the thermal use, it will depend on the frequency. For a frequency of 3, which is what we talked about earlier for the less dense area, you would want to use an intensity of 0.5 watts per centimeter squared. And then for a frequency at 1, which is for those deep tissues, deep structures, you'd want to use 1.5 to 2 watts per centimeter squared. Now, if it is a fracture and you're using the non-thermal use, you would want 0.2 watts per centimeter squared. And then last on our flow sheet, we have the duration. So it is twice the size of so for any area that is twice the size of the transducer head, it's 5 to 10 minutes. So if you have an area that is twice the size, you'd go between 5 to 10 minutes. If you have an area that is 4 times the size of the transducer head, you'd go 10 to 20 minutes. Now, if you increase the duration of the treatment if there's a decrease in both intensity and frequency. If you are using the ultrasound to facilitate bone healing, you go for 15 to 20 minutes. Now, for those of you who don't know, the transducer head looks like, so this is the ultrasound machine. It'd be the round head right there. All right, thank you. That's our demonstration on ultrasound.